morning, everyone. We all know that early detection is the key to overcoming cancer. But what are the warning signs that we should be looking out for? What are the precautions that one could take if you have a family history of cancer? Does exercise reduce the risk of cancer? And are there any vaccines available for cancer? Answering all of these questions and more in the live session is Apollo Hospital's Director of Oncology, Dr. Anil D'Cruz. He's got over 30 years of experience and he will be sharing some expert tips with us to help us prevent cancer. So do not miss out on today's special episode of the Health Hour series. See you guys at 11 a.m. on Apollo 24/7's Facebook page and YouTube channel. Do join us with your friends and family and ask all of your questions live. The link is given below.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste and a very warm welcome to all of you. This is Vidya Malavde and I'm super excited to be a part of this one-of-a-kind live health hour show, which has helped so many of our viewers connect with leading Apollo experts even during the most difficult times. Through the Health Hour, Apollo 24/7 aims to bring the best doctors from Apollo Hospital to your homes every Sunday so that you can discuss your health concerns and get answers to your health-related issues live. And if you want to avail the entire range of services by Apollo Hospitals from the comfort of your home, I strongly urge you download the Apollo 24/7 app. Here you can book virtual consultations with the best Apollo doctors, order your medicines online, and even get home sample collection for your lab tests, all with Bus It Tap. Let me also tell you about the wonderful Saving a Child's Health initiative, SACHI, by Apollo Foundation that aims to provide the best pediatric care to children in need at no cost. So if you wish to know more about it, please check the link in the description box or scan the QR code on the screen. Coming back to the show, today we are here to discuss a very important topic: cancer, separating facts from fiction. I'm sure all of us have many questions like, what are the warning signs of cancer? Can men get breast cancer? Why are cancer cases on the rise amongst young people today? To answer all of this and more, we have Dr. Anil D'Cruz, Director Oncology of Apollo Hospitals, Navi Mumbai, here with us today. So start typing your questions now and we'll take them up with Dr. D'Cruz one by one during the course of the show. Also, watch out for that quiz right after the live Q&A session where you can win exciting gifts, discount vouchers, and so much more. Let me introduce and welcome Dr. Anil D'Cruz to the show today. He's got over 30 years of experience treating and healing patients with severe cases of cancer. He was also the ex-director of Tata Memorial Hospital. He's well recognized as a global leader, clinician, researcher, and teacher in head and neck oncology. He's trained for head and neck surgery at Sloan Kettering Cancer Center, New York. President-elect 2018 to 2020 and President 2020 to 2022 of the Union International of Cancer Control, Geneva. An avid researcher, and his landmark contribution in management of neck nodes and oral cancers awarded him the plenary at the American Society of Clinical Oncology. Authors of several papers in national and international publications. I really want to welcome you, Dr. Ranil. It's such an honor and what a pleasure it is. I've been talking to you over the last half an hour, and I think we're going to have an absolutely spectacular show talking to you. So thank you so much for joining us today.
Namaskar. Thank you, Vidya, for having me on the show. Thank you for the kind words of introduction. I always say if my wife heard these kind words, she would treat me kinder. So, but thank you so much for these kind words. I'm delighted to be here, and I just hope it can be interactive and we can solve doubts, allay anxieties of people who tune in and ask me questions today.
Certainly, doctor. Absolutely. And without wasting any more time, here's my first question to you. Why is it so important to know about cancer?
Uh, a very nice question, a very apt question, and many people ask me this. Cancer is a disease that is increasing in frequency. I always say most of us, or all of us, will have someone who we know within our sphere
Yeah.
who's been afflicted by this disease. It could be a colleague at work, it could be someone in your family, it could be a neighbor, a neighbor, it could be a friend. So the incidence of cancer is increasing. Cancer was called the big C. People were scared with this diagnosis. They felt it was the end of the road. But that's a myth. If you diagnose cancer early, it's totally curable. Any cancer is of various types. It's actually a heterogeneous group of diseases. But if you diagnose any of these cancers in stage one, we have a 90%, upwards of 90% success in the treatment. You have less side effects, treatment is simpler, and patients get cured. I'm going to draw an analogy with diabetes or hypertension. You get diagnosed with these in your 40s and 50s, you have to take that medication for life. But if, God
Yeah.
forbid, you get diagnosed with cancer, you come in early, you're cured, and you're back to normal. You're back to your normal life. You don't have to take medications for years. So I crusade, I go the world over taking this message: come in early, take less treatment, get cured, and go back to meaningful life. And that's why cancer is
Absolutely.
very important. You have to fight this ignorance with knowledge. And that's why there's shows like
Right.
this that help people come in early, diagnose, and get cured.
Absolutely. Thanks to Apollo 24/7. What are the common cancers, though, in India?
So if you look the world over, lung is the
Hmm.
commonest cancer. Lung cancers, and it's predominantly because people smoke. The incidence is rising, and it's one of the top five cancers in our country as well. In our country, if you look at head and neck, and I'm an expert of head and neck cancers, about a third of
Right.
cancers are in the head and neck. What do you mean by head and neck? It's the area that starts from your lips and goes all the way down to the bottom of your throat. Now, there are about 14
Got it.
different sites. Just to give you an example, cheek, the tongue, the jaw. So, about a third of our cancers are head and neck in our country, and that's because of tobacco and the way we consume tobacco. So, in India, about
Oh,
20% of our 27% of our cancers are head and neck, as opposed to the West, where it's only 4 to 5%, because they don't chew tobacco, they don't smoke the bidi, they smoke cigarettes. So lung cancer is number one. We also have a high incidence
right.
of lung cancer in our country. So quickly, if I have to recall, there are five top cancers in our country. Two of them are in the oral cavity, that's the cheek and the tongue. Lung is very, very common. And then the female cancers, which are breast and the cervical cancer. So the cervix is the mouth of the womb or the mouth of the uterus. It used to be the number one
Correct.
cancer in our country, but slowly, as lifestyles are improving, people become more aware. Breast cancer has now surpassed cervical cancer, particularly in major parts of the country, as the number one cancer that we have in our country.
Oh my God. Okay. Oh, that was quite insightful. What would be the warning signs, though, of cancer? How do you know?
So many people ask me this question, Vidya, how do we know we've got cancer? There is no one
Hmm.
test that can tell you whether you have cancer or no. पीपल से पेट
Hmm.
स्कैन कराओ, सीटी स्कैन कराओ, ब्लड की टेस्ट करा के हमको बताओ कि कैंसर है कि नहीं. There is no one test that
Huh.
can tell us whether we have cancer. Remember, cancer is a heterogeneous group of diseases. When I say heterogeneous, means diverse group,
What
अलग
does it
अलग
mean? Yeah.
तरीके, अलग अलग तरीके. तो
Correct.
ब्रॉडली कैंसर दो
हाँ
किस्म
जी.
के होते हैं. One is called solid organ cancer. So solid organ means like a lung cancer, a liver cancer, a
Lung.
cheek cancer, a tongue cancer. That's solid organ. And the second is hemopoietic, blood की cancers. Blood के cancer में leukemia,
Correct.
lymphoma होती है. Now, if you have a cancer in the liver, the signs are different than if you have a cheek cancer. So you have to know the warning
Correct.
signs of cancer. I suggest, and in the
Hmm.
interest of time, I'm not going to spell it out, but I'll tell it very simply. There's an acronym called CAUTION, CAUTION. So, those of
CION.
y'all who are listening, please Google this acronym. Put in Google caution and cancer. It will give you what C
Hmm.
stands for, what A stands for, what U stands for, what T stands for, what I stands for, what O, and for what is N. So, to give you an example, N is nagging cough. If it is C, it is
Oh.
change in bowel or bladder habits. So supposing
Huh.
you were passing motions once a day, that was your routine. Suddenly your habit, you become constipated, or you need to pass more often, or you get a sense of incomplete evacuation, or there's blood in your stool, it changes
Hmm.
color. It
Hmm.
could be a gastrointestinal cancer. You need to go and see your doctor. You have unusual bleeding from any orifice in the body. It could be the nose, it could be the
Hmm.
mouth, it could be coughing out blood,
Mouth.
it could be in your urine. Ladies could have abnormal bleeding which is not correlated to the menstrual cycle, intermenstrual bleeding,
Correct.
postmenopausal bleeding, postcoital bleeding. All these need to be
Hmm.
investigated. So you have a lump in your
Correct.
body. Suddenly you develop a lump in your breast. You run to your doctor, particularly if you're above 40, rule out a cancer.
Hmm.
It's very, very, how should I say, paradoxical that people who are very aware of their health will come into the doctor
Hmm.
with the slightest change in their body, in
Hmm.
symptoms, and say, Doctor, investigate karao,
Hmm.
there's something wrong with me. And nine times out of 10, we do
Correct.
pick these cancers up very, very early. So I want people to be aware of their health. Any change in your
Right.
habits, any change in any existing swelling, any new swelling in your body, you need to run and see your doctor. You don't have to run on day one. If these symptoms persist for more than 3 to 4
Persist.
weeks, that is important. Now, the other thing I want to tell
Right.
you, and I'm going to make it very simple, 66 or 50 to 66, or half to two-thirds of cancers are preventable. The three main causes of cancer are: one, habits, tobacco and alcohol. Like I told you, in India, a third of our cancers are tobacco related. So if you have these habits, you have a high risk of getting cancer. The second common cause is infection. Human papilloma virus, very common for the cervical cancer. Hepatitis, very common for liver. HIV, very common for lymphoma and Kaposi, so infections. And the third is
Oh.
obesity. Obesity. Many people believe if I'm malnourished, I'll get a cancer. Yes, if you have a good diet rich in vitamin A, C, and E, your incidence of cancer is less. But if you overeat and
Mm,
you're obese, you run the risk
mm,
of at least six cancers, and that's categorically proven. So you must maintain your body surface area within what is recommended for your height and age. So obesity also lose. Very common in women. Breast cancer, more common among people who are obese. Pancreatic cancer, colorectal
obese.
cancer, uterine cancer, gallbladder cancer, kidney cancer. They're all obesity related. So watch your weight as well. So these are the important
Right.
messages that I would like to tell people about what causes cancer and what are the warning signs of cancer. So if you're a smoker and you have a nagging cough that
Mm.
persists for more than 4 weeks, you need to go to your doctor and see.
But doctor, tell me, why are cancer cases so much on the rise in the younger people these days?
So, cancer, like I said, is a lifestyle related disease. If you look at WHO statistics, which we call Globocan, which again is a free download from the net, so people may want to see, cancer was about 12 million cases globally in 2012. In 2018, it became 18 million kids globally. And in
Oh my God.
2020, it's gone up to 19.3 million. So in from 2018 to 2020, it's gone from 18 million to 19.3 million. They say
19.3.
one in five men and one in six women will get cancer in their lifetime. Now, in our country, what is happening is that our standards of living are improving, our lifestyles are changing, people have more access to healthcare, so the incidence, plus we have 1.3 billion people. All these years our population pyramid was such that a lot of people were less than, like they were in their adolescence and newborns. But as our population pyramid
Right.
changes, we have more people who are aging, we will see more incidence of cancer. But given that our population pyramid still has younger people as opposed to the West, where there are people who are 70, 80, we see more cases of younger people in our country. So, generally, the dictum is that cancer in our country is seen a decade earlier than in the West, but it's predominantly because of our population
Hmm.
pyramid. We've got a large
Population,
number
right.
of patients, we get more aware of it, and that's why we feel that it is more in younger people.
Okay, I guess. But I'm sure even lifestyle has a lot to do with this, isn't it?
Yes,
And the
definitely.
stress that we lead. That.
Yeah, so like I said कि it's अपनी आदतों पे depended है. As we change our lifestyle, the higher the chance of getting cancer. As we have more affluence that comes into our lives, we start eating more of a
Hmm.
Western diet. I'll make a very
Yes.
simple analogy which will probably drive the point home. Maybe I'll quote two cancers. Now, in our country, intestinal cancer, which we call colorectal, is relatively
Hmm.
less than as seen in the West. It's one of
Yes.
the top cancers in the West. Why do you get colorectal?
Hmm.
Colorectal means large intestinal cancers. There are two main etiological factors, two main reasons. One is eating
Yeah.
too much of non-vegetarian, these fatty foods. But more importantly is the transit time in the gut. That means if you have food which has less roughage, you have less
Right.
rice, less veggies, the food stays in your gut longer. The gut is
Yes.
exposed to those carcinogenic agents. Now, all along in our अपने देश में we used to eat a lot of rice, lot of green leafy vegetables, so the transit time was not
Yes.
there. Slowly, our lifestyle is
Yes.
going to the west, and we've grabbed a burger, खा लिया, भाग गए, so our lifestyle is changing. Look at breast cancer.
Correct.
Breast cancer, if a lady has multiple pregnancies, breastfeeds a child, the incidence of cancer of the breast is less. Now, today, the modern lady quickly only one child, then no breastfeeding, I have to get back to work. So I'm not saying go have multiple kids and breastfeed all of them and give up your work. No, that's not the message. But what I'm saying is lead a healthy lifestyle so that it can negate the effects that we are not doing. So if you keep your weight in check, you
Right.
have a good healthy diet, you are exercising well,
Mm.
you breastfeed your child, the
Mm.
incidence of breast cancer will be much lower.
Much lesser. Absolutely. But
Yeah.
how do you provide the best outcome in cancer? I'm thinking early detection is the way to go,
Yeah.
isn't it?
So like I said, cancer is preventable. But if you again look at cancers, there are four stages of cancer: one, two, three, four. If it's stage one or two, we call it early cancers. Survival
Mm.
across most cancers is upwards of 70-75%. So we are going to cure the majority of people. If you come with
Right.
locally advanced stage 3 and 4, then the survival can vary from 0 to maybe 50%. So it's intuitive, it's logical that you should come early. Second, if you
Right.
come early, we treat with single modality therapy, either surgery, either radiotherapy. So generally it's single. So you
Mm.
can, if I give surgery, radiotherapy, and chemotherapy, the effect on the body is more. Function, cosmetic problems are more. So to
Correct.
improve
Correct.
outcomes, come early. You have an upwards of
Right.
90%. But there are one, two other
Mm.
important things to improve outcomes. You see, being in the Tata hospital for 30 years, seeing people from all over the country, and even now at the Apollo, because of my status, I see patients from all over the country. About 80 to 85% of patients who see me are pan India. It's not a localized Bombay or Delhi practice, the two places
Correct.
that we go, it's a pan India. And 50% of the work I do इज रीडू वर्क. रीडू मतलब पहले उन्होंने कहीं कोई ट्रीटमेंट ली, अधूरा था ट्रीटमेंट, एंड देन दे कम टू मी. So
Oh,
it's a stress to the patient, a financial stress, a psychological stress. It is also that now we are compromising outcomes. It's a stress to me. I had a mop full of
yeah.
hair, Vidya, when I was younger, but doing these redo cases, सब बाल भी मेरे झड़ गए. So the message, on a more serious note, is when, God forbid, you get diagnosed with cancer, go to a specialist. Don't get panicky
Right.
and run to anybody immediately. Today, thanks to our governmental policy, we have a lot of good institutions pan India. तो आप पूछताछ
Yes.
करिए, find out who's the best person for that cancer, that the institution has the facilities, and then go. I'm going to
Mm.
again make a very
Right.
simple analogy. If you are buying a new car, if you're buying a new TV,
Mm.
if you're buying a new fridge, you will make 500 inquiries. You'll go to 500 shops, you look at the
Yes.
best price, you look at LG में क्या है,
Mm.
सैमसंग में क्या है, सोनी में क्या है, इसमें क्या है. आप
Right.
मेडिसिन के लिए भी इतनी जानकारी करिए ना, then you go to your doctor. And when you go to a
Correct.
doctor, today we've gone into what is known as site specific. So I'm a general surgeon by training. I'm qualified to treat every part of
Mm.
the body. But I don't
Mm.
operate breast. I don't operate it colorectal. I have a team with me. I only specialize in
Correct.
head and neck cancer. And that's where Apollo, we are making a change. We are driving what we call
Mm.
niche area practice, specialty practice. And not only Apollo,
Correct.
most of the leading hospital today are driving this agenda of niche area
Right.
specialized practice. रोबोटिक की जरूरत होगी तो आप रोबोटिक स्पेशलिस्ट के पास जाइए. That is important, and then you
Hmm.
will improve your outcomes. So my message for y'all is early detection and go to the right center to get treated, and you will have good outcomes.
Absolutely. That was, I think that is the main thing to do. Early detection and then go to the right person. And I think that will hopefully, um, this is something that even I am quite, I think this is the one thing that I'm scared about, cancer, because in my family history also there has been people who've had cancers. My great grandmother, my grandmother, same cancer. So it's actually been it's something that I get very scared of for myself and for my mother as well. But tell me, what are the causes of cancers and how can one prevent them?
So
Is
I
it
told
possible to
you
prevent it?
I told you two-thirds are lifestyle related, no smoking. If you drink, it should be in absolute moderation. So, alcohol and tobacco
Mm,
are the two most dangerous factors for cancer. If you have both the habits, the effect or the risk is potentiated. Supposing the risk with tobacco is X percent and the risk with alcohol is Y. If you do both, it's not X plus Y, it's X into Y. So please stay off habits. Tobacco is the one single habit that causes the most cancers, and you have to stay off. There's absolutely no benefit of tobacco. अपने देश में we have what is known as global adult tobacco survey. It's done every couple of years where they survey people in various districts in our country. The amount of people, like close to 40% of our men have consumed tobacco. About 15% of our women have consumed
my
tobacco in
God.
either the smoked or the smokeless form. You know, as I treat patients, there will be people who come from the interiors of Maharashtra. I'm based in Bombay predominantly, or even here up in Delhi where I practice, from, from smaller villages, smaller towns. They start using tobacco at the age of 15, 16, 18. uh, it's a socially accepted custom in our country. They just use it. They just believe it has to be done. People brush their teeth with tobacco. People apply mashari, which is burnt, pyrolyzed
Correct.
tobacco. You get it in the form of toothpaste. There's so many toothpaste that are, it's a mistaken belief. So now these people start using tobacco at 15. They've used it for 15, 20 years. They're in prime of life. Two young kids, 35, come with a full blown cancer. Lack of knowledge. So, to prevent, no habits. The second thing I said, infections. Keep yourself clean. The HPV virus that causes cervical cancer, which is the mouth of the uterus, the womb, is predominantly because of a virus. And that is spread by multiple partners. Poor hygiene among ladies, unprotected sex with people you don't know, that causes cervical cancer. So please keep your body clean. Hepatitis, when you go to a right place for your tika, for your injections. People who do sterile use disposable, though of course there's now a legislation you can't reuse needles, syringes. But be careful, it's an open packet. You
Correct.
don't get it from someone else. Your blood is properly screened. Again, mandate in our country, but in smaller
Mm,
places, unsupervised, you need. So that's, and third, as I said, is obesity. Keep your weight in check. Now I'm going to give you another tip. A lot of research has
mm,
shown, and these are epidemiological studies. What do you mean by epidemiological studies? Epidemiological studies means studies done on population out in the countryside among people. There are more than 300 studies that show that people who have a good diet do not get cancer.
mm.
Now, the diet
Really?
that you need to take, yeah, the diet that you need to take is a chemo preventive diet. It should be rich in vitamin A, C, and E, what I
Mm,
call ACE vitamins. When you play cards, the ACE is the most powerful on the deck. So remember A, C, and E.
right.
अब लोग हमसे पूछते हैं कि
Right.
ये ए सी एन ई किस फूड्स में है. आई टेल देम,
Oh,
go and buy a fourth standard science book and you'll know what's important with the ACNE. But I'm going to tell you something simpler. The more colors
yes.
you have on your plate, you have covered vitamin A, C,
Right.
and E. Bright, lal tomato, capsicum, simla mirchi,
Correct.
yellow, green, colored,
Green.
grapes, apples.
Correct.
So you should have at least
Apples.
four
Yeah.
portions of fruits and veggies. It is very protective.
Every day.
Now, people didn't eat their fruits and veggies and started buying fancy tablets. You get them online. Some relatives are coming from the US, they will send some bottles of things. So, a lot of
Yes.
research
I
is
was just
done.
going to say that.
If you take it in the capsule form, there is not much benefit seen. You must take it in the normal form. So I tell people, I
Hmm.
did a show yesterday on what we call the oncology support group. I tell people
Hmm.
that please eat in moderation, eat a diet rich in vitamin A, C, and E, and rotate your diet. So again, nuts are very good, but you don't keep eating two handfuls of pistas and two handfuls. Firstly, you may not have money to afford so much, but more important, rotate. आज आपने अखरोट खाई,
Hmm.
कल थोड़े से कैजू नट्स ली, फिर मंकी नट्स ली. सो रोटेट सेम वे विद योर फ्रूट्स. आज आपने
Hmm.
गाजर खाई, कल थोड़ा सा टमाटर, कल स्पिनिच या पालक, so that you get all your green leafy vegetables and fruits. So chemo preventive diet is very very important. So quickly to no
So
habit.
basically,
हाँ
sorry.
जी. No
Go
bad
ahead.
habits. Keep yourself clean. Avoid
Like
infection.
smoking and
Obesity.
alcohol.
So yeah, obesity. So keep your body weight all correct. Exercise regularly and eat a diet which is chemo preventive. There are other cancers that come that could run in families. Those people just need
Hmm.
to be careful and go for regular checkups. We call that as opportunistic
Checkups.
screening. Yeah, yeah, yeah.
Hmm. That's what even I always keep saying all the time, that eat the rainbow every day. And
Correct.
that's like a part of my diet routine as well, being a yoga teacher or a wellness person or whatever. That's something that is non-negotiable. All colors every day. It just looks nice. And I think lots of antioxidants from all of these vegetables that you can get. Instead of just heading over to the burgers and pizzas, which are great to have maybe once in a while, but coming back to normal. And I think Indian food also has a lot of these spices and a lot of these other beautiful things that you can, with the turmeric. Now, world over, everybody's talking about turmeric and how good it is. We've been using it since I don't even remember, since our great
Yeah.
grandmothers and more. So I guess that plays a
A,
really important role,
a
along, of
very,
course, with exercise and all the other things that you've noted.
a very important point about turmeric. Turmeric or curcumin is known to be
Mm.
chemopreventive. It's an anti-inflammatory. When we have a sore throat, our grandmothers taught us कि
Yes.
हल्दी दूध में ले लो. जख्म होगी तो
Mm.
curcumin डालो, हल्दी
Haldi
डालो,
lagao.
ठीक हो जाओ.
Mm.
But
Mm.
that is the kachi haldi. Remember one thing, the
Mm.
unfortunate part about curcumin is when you eat it, or turmeric, it doesn't get absorbed. It all passes in the intestine.
Right.
So that's one more reason why we have a lower incidence of colorectal cancers in our country. Now researchers are trying to make nanoparticles, put a little bit of piperine or haldi, put various oils so that curcumin
Huh.
can get absorbed. So again,
Absorbed.
our Department of Biotechnology, Government of India did a lot of funding to research against curcumin. हम लोग लेबोरेटरी में असर देखते हैं, बट आप ये curcumin की टैबलेट खरीद के खरीदोगे, that will not do the benefit as much as having a normal healthy diet with a little bit of all your protective spices in it. So that's the other message
Spices.
that I would
True.
want to give.
Absolutely. Now I'm going to jump into all of these questions that have been coming to me. So first question is from Ms. Shweta Karedi. Please explain to us about uterine cancer.
So the uterus is a very important organ in all females. The uterus basically has the corpus or the body of the uterus, and it has the mouth of the womb, which is called the cervix. I've already spoken on cervical cancer, which is the number one cancer. And today, you could diagnose it early by doing a very simple test called a pap smear or an HPV
Yeah.
DNA test. That HPV is the human papilloma virus DNA test. Freely available, you can go to any good center and you can get diagnosed. It should be diagnosed at a very, very early stage, close to 100% cure rates, even for early stage cervical cancer. If it's in the pre-malignant
How
stage,
often, doctor? Sorry to ask you in the middle, but how often should somebody go for this test?
so after the age of 35, every 2 years, at least three they should do. But if you do the HPV DNA, generally if you do it once and you're okay, you're good enough. At least one screening is very, very important. That is important with the screening for HPV. In fact, with the WHO has given a call globally to relegate cervical cancer to the history books, and they do it with pushing towards universal vaccination of against the
Ah,
HPV. Yeah, so we call it the 90-70-90 program of the WHO, again freely available. So basically, vaccinate 90% of our girls, screen 70% of people, and treat 90% of people who come in the pre-malignant stage. So cervical cancer
mm,
goes through various stages. It goes through mild dysplasia, moderate dysplasia. Dysplasia means bad, bad plasia, cell. So mild,
mm,
moderate, severe, then it's carcinoma in situ, where the cancerous changes is still confined to the cell, and then there's invasive cancer.
mm,
We call it in our
mm.
technical terms SIN 1, SIN 2, SIN 3, SIN, CIN, cervical intraepithelial neoplasia. But not to get confused, this whole process takes 10, 15, 20 years. So if the lady is going regularly for checkup, we will get it in sin 1, sin 2, sin 3. We can do local treatment. If she's not completed a family, we don't have to remove the whole uterus. We can have local treatment
Mm,
of the cervix, and we can still
right.
preserve fertility and cure this patient, this lady, from going into cancer. So that is cervical cancer. So, do your tests regularly. Young girls to be
Mm,
vaccinated, and if you have these pre-malignant lesions, get treated by a qualified doctor, and you can preserve your fertility if you have not completed your family. You don't have to have your entire uterus out. Now we come to the body.
taken away.
The body of the
Mm,
uterus also is now having an increased incidence of cancer. And one of the important things, like I told you, is obesity. Now, what happens if,
mm,
how will you diagnose this? Remember, the uterus, ladies have their menstrual cycle every year. Now, the moment you have
correct.
abnormal bleeding, heavier than normal periods, you have postmenopausal bleeding, you have spotting, you need to go and get yourself investigated. The simplest test that you need to do is an ultrasound, sonography of your abdomen and pelvis. When you do sonography
Mm,
of your abdomen and pelvis, the doctor will tell you uterine wall thickened. If they say that the
correct.
uterine wall endometrium thickened, then we go ahead and we
Yeah.
do a DNC, we see for abnormal cells and we treat it. Now, I'm going to say this on a lighter note. God forbid you got a uterine cancer. If the cancer is less than 50% of the myometrium, myometrium means the thickness of the muscle wall of the uterus, your
Mm,
cure is close to 100% with surgery. So, please, ladies who are listening to this, and thank you for asking me this question. If there's any abnormal bleeding, please go and get yourself evaluated. Do not neglect. I told you it's very simple. Your doctor will examine you, and you need a simple sonography as a it's freely available. It's not a costly test. It doesn't radiate you. So there should be absolutely no excuse as to why a lady
sure.
should come in stage 3 or 4. अपने देश में cervical cancer 60-70% stage 3 and 4, absolutely curable, preventable. And it's just not
So
proper.
bleeding is the one warning
Yes.
sign,
Yeah.
isn't it?
Yeah. So if we are talking
Literally
about
bleeding.
bleeding, yes, ladies, if you have any type of abnormal bleeding which is not your regular menstrual cycle, I repeat, heavier than normal bleeding, intermenstrual bleeding, postcoital bleeding for cervical cancer,
Right, right,
please go to your doctor. And for that matter, bleeding from any orifice. You have unilateral bleeding from your
right.
nose, one side of your nose. It's not because of hypertension. If you have not put your finger in and dug your nose and traumatized it, please go and see a doctor. You have bleeding in your cough, go and see a doctor. You have bleeding from your ear, go. Men, if you have bleeding in your urine, please go. You have bleeding through the rectum in your stools, please go. Don't say कि मुझे hemorrhoids है, piles है, ये तो सबको होती है. And if you're bleeding in the upper part of your intestine, the blood changes color because the acid in your food mixes with the blood. So when you pass stools, your stools will be dark brown or tarry colored. That again gives you a clue. It won't be bright red. So bleeding from anywhere needs to be investigated for cancer.
So, doctor, moving on, I have a question from Mr. Sami Ahmad. I'm suffering from prostate cancer stage 1. Is it safe for me to be underweight and watch? No, it's
Oh,
not.
this is a very interesting question. It's a debate the world over. So generally, when you have so as a man ages, in our books it's written, as a man gets white hair, so also the prostate gland swells. It's usually non-cancerous. We call it BPH, benign prostatic hypertrophy. Men above the age of 50, 50% of them will have enlargement of the prostate gland. Now, in some people, this enlargement turns into malignancy, diagnosed very easily with what's called a PSA, a blood PSA. It's a tumor marker, prostate specific antigen test. And again, a simple sonography. We initially do it from the abdomen, but we can also do transrectal to see the prostate well. Now, because of modern medicine, because more men are being aware of prostate cancer, they go for screening and they get this cancer very early. In fact, if you do autopsy on men dying of other causes, many of us might have small changes of prostatic cancer in our prostate, which actually we call a laboratory cancer. If not for modern medicine, we may not have diagnosed it. And when the good Lord wills, we go up for other causes. So now we get diagnosed with these cancers and we don't know what to do with them because the treatment implications are quite a lot. So there are three methods by which we treat early prostate cancer. One is just surveillance. We keep the person under regular follow-up, monitoring his PSA and doing an imaging at the appropriate time. The other two methods are doing surgery, that's removing the prostate, and today it's done by robotic, and that's the best method of doing it, or we give localized radiotherapy. Now, to decide whether you should be only under surveillance depends on various factors. Your doctor will assess the biological aggressiveness of your prostate cancer. They look at certain scores, like there's a Gleason scoring on the prostatic cancer. The number of cores, they take multiple cores from your prostate when they diagnose it. They look at the number of cores that are positive. They look at the grade of the tumor. They look at the size of the tumor. They look at the PSA
And then
value,
accordingly.
and then they triage patients into various groups and decide, okay, you have the laboratory cancer, Mr. XYZ. You are going to come for regular follow up. We are not going to treat you. You're 78, 80. This is not going to trouble you. Please regularly check up now. But by and large, the dictum is,
Correct.
if it's younger, it's a little more aggressive, the patient then goes into surgery or radiotherapy, and both have the pros and cons. Again, we decide who needs what kind of treatment.
Right. So the next question is from Mr. Rajendra Verma. I had a lump in my backbone and have had it for more than 5 years. There's no change in size. Should I consult an oncologist or an orthopedic surgeon?
Uh, Difficult question to answer, Mr. Verma. Do you feel the lump when you say it's in the backbone? Generally, backbones are very, very difficult. मैं तो कोशिश करूंगा मेरी backbone पहुंचेगी नहीं. How did you diagnose it? Did you do some imaging? Is it felt? Can your spouse feel the swelling? Is it in the bone per se, or is it outside the bone? So it's very difficult. But the dictum is,
Right.
if it's for 5 years and it is static, it's unlikely to be a malignant disease. Please remember, any malignancy will grow. It might grow slowly, but it will grow. So, what I would suggest is you need to get a proper imaging, and backbones are best imaged by an MRI scan. एमआरआई स्कैन
Hmm.
कराइए, उससे हमको मालूम पड़ेगा कि whether this is a suspicious bone or suspicious growth or no. If it is, we'll do a biopsy.
Correct.
If it's not, we'll just keep you under follow up. You can go to anybody.
Hmm.
Usually you go to an oncologist only when you have been diagnosed with cancer or your symptoms are very, very strong towards cancer. Since it's 5 years, I would say you can consider your orthopedician locally, or if you have a cancer specialist locally, go ahead. If you came to me, I'd probably examine you. If it's in the skin, subcutaneous tissue, I feel it's like a benign growth, I may not even ask for an MRI. So just go to anybody, a
Hmm.
well qualified, they will do an MRI. But if they say there's something suspicious, then please go to the oncologist for the biopsy. Like I told you in the beginning, go to people who are qualified in that field.
Right. The next question is from Mr. Sharad. How can we stop cancer from reoccurring? Head and neck.
Uh, is it for any
I think
particular
generally
cancer?
also how does head and neck is what he's written, but also
Okay,
generally also reoccurrence is also quite a thing in I
yeah.
think when it
Sharad
comes to
ji,
cancers.
again, a very, very difficult question. Probably if I knew the straight answer to this, I would be a Nobel Prize winner as well. But I'm going to give you some tips. You asked first on head and neck, I'll answer head and neck, and then I'll tell you for other
Hmm.
cancers. हेड एंड नेक कैंसर्स इन 90% ऑफ पीपल तंबाकू से संबंधित है. तो हमने आपकी गाल
Hmm.
की ट्रीटमेंट की, हमने आपकी जबान की ट्रीटमेंट की, आप क्योर हो गए. देर इज अ 1% रिस्क ऑफ अ patient who is cured of the index cancer, the cancer with which they came to me to get a second primary cancer anyway in the upper aerodigestive tract. बिकॉज आपने तंबाकू यहां से स्टार्ट की, यहां कैंसर महसूस हुई, बट तंबाकू का असर इज ऑलरेडी इन योर गला, इट्स ऑलरेडी इन योर लंग्स. इफ यू वर स्मोकिंग, यू कैन गेट अ सेकेंड कैंसर. Now we have tried to research, we means the world, कि ये कैसे प्रिवेंट करें. हमने कीमो प्रिवेंटिव ड्रग्स दी इनको. कीमो प्रिवेंटिव मतलब रिच इन विटामिन ए, सी एन ई. बड़े रैंडमाइज ट्रायल्स हुए विद मोर देन 20-30,000 पीपल गेटिंग कीमो प्रिवेंटिव ड्रग्स, अनदर 20-30,000. कुछ डिफरेंस नहीं आई. So for those who have a head and neck cancer, to prevent recurrence, please stay off your tobacco. Many people get cured and go back to tobacco. I counsel my patients. I say sometimes हम लोग supari is equally harmful. It's absolutely no
Hmm.
no. मैं अपने patients को बोलता हूँ कि जब आप सड़क पे चलोगे, पान की दुकान दिखे, आप सड़क के दूसरे साइड पे चलिए. इतनी हानिकारक है आपके लिए. I make my point very strong to them. If I go out for a
Right.
wedding, I might eat a meetha pan, or I go out for some good food. We sometimes get tempted to have. आपके लिए वो भी एकदम not allowed है. So to prevent recurrence, no tobacco, alcohol, absolutely, sir. And please take a diet rich in vitamin A, C, and E. There is a finite
Hmm.
risk of getting your cancer back or getting a second primary cancer. You have to go for a regular checkup. हेड एंड नेक कैंसर में
Hmm.
द रिस्क ऑफ रिकरेंस इज इन द फर्स्ट 2 years. पहले 2 साल तक आपकी बीमारी वापस नहीं आई, 80-90% खतरा टल चुका है. तो प्लीज गो टू योर डॉक्टर every 6 to 8 weeks. God forbid you're in the unlucky group, we can catch it when it's at a very early stage and treat you. If you just लापरवाही करोगे,
Right.
you'll again come with advanced, and it's very, very difficult to treat the patient. Now, coming to other cancers, let's say breast cancer, exactly the same analogy. A lady has a lump in the right upper outer quadrant of the breast. We treat her, we cure her. The rest of the breast, the opposite breast, was also exposed to the factors that cause the cancer in this breast. So, what causes this cancer? Obesity. Ladies who get obese post treatment, who maintain their high weight, have a higher incidence of getting that cancer back. Weight ठीक रखिए and go back to your chemo preventive diet. Exactly the same with
Right.
colon, exactly the same with other cancers. So healthy lifestyle, regular checkup. But Mr. Verma, please remember, I think it was Mr. Verma, no, Sharad ji who asked this question. Sharad ji, please remember
Yeah.
that go to the right place up front. कि आपकी ट्रीटमेंट करेक्ट हो, रिकरेंस के चांसेस एकदम कम होंगे एंड you'll be cured of your cancer if you go back to a healthy lifestyle. So that's my message to you today.
The next question is from Mr. Deepak. For a person with a family history of cancer, what kind of precautions can one take? Does family
So
history
again,
matter?
Deepak ji, a very, very relevant question. It's a very broad question for me to answer on the show, but quickly I'll tell you. Like I told you, habits are the main cancer. Then we have about 10 to 15% of cancers which are hereditary. Now, certain cancers which are familial या hereditary, right, run in the family. I'll just give a few examples. छोटे से बच्चों में रेटिनोब्लास्टोमा होती है, आई की कैंसर. ब्रेस्ट कैंसर कैन बी हेरिडिटरी. You can have colorectal cancer that is hereditary. There's certain syndromes that are hereditary. For example, in my field, there's a thyroid cancer called medullary thyroid cancer. It can run in the family. If you have a medullary thyroid cancer, 50% of the offspring will have medullary thyroid cancer. Now, each cancer which is hereditary usually has some screening mutation or a screening test that will help us to diagnose. To give you an example, in breast cancer, there's a mutation called the BRCA mutation. If you all recall,
Hmm.
Angelina Jolie had her breasts removed even when she did not have
Yes.
cancer because she carried the BRCA mutation. Now, we are not going to discuss any personal cases, and I'm not going to discuss the merit of doing a prophylactic mastectomy because that is a full talk of 1 hour. But there is a
Hmm.
test. So, if you have multiple first degree relatives who have a breast cancer, BRCA की mutation होगी. Exactly the same with ovarian cancer. There's an intestinal cancer called colonic cancer. It comes in people who have polyps. It is governed by what is known as
Hmm.
an FAP, familial adenomatous polyposis coli. There's a gene that we can diagnose. For my medullary thyroid cancer, we have what is known as a RET proto-oncogene gene. If you don't have the RET proto-oncogene gene, that that offspring is not going to get the cancer. Otherwise, we operate earlier. So please consult your doctor if you're at a high risk of a cancer, and please do these screening tests which are applicable to the cancer that your family has. And if there is no screening test, just be under regular follow up, avoid the factors that cause that cancer. And if you have any symptoms, rush to your doctor earlier. So, again, in brief, that is my advice to Deepak ji.
Right. So the next question is from Ms. Vasudha Rani. Of course, we've been talking about the food that we should be eating, like the diet with vitamin A, C, and everything. Are there any foods that we should avoid? Cancer-causing common foods that we can avoid. You were talking about non-vegetarian food as well some time ago. Um,
So
does that come into this in any way?
yeah, but that doesn't mean you just avoid non-vegetarian food. Non-vegetarian food is a rich source of protein, but yes, there are a lot of vegans, there are a lot of people who are pure vegetarian who also lead an absolutely healthy lifestyle. So basically, eat food in moderation and eat healthy. So the foods that you should not eat are foods that are rich in trans fats. I mean, you just Google, you'll get
Correct.
a whole load of foods. literature is replete with examples of foods you should eat and foods you should not eat.
Packaged
तो
food.
जनरली आप
Right.
अपनी कॉमन सेंस यूज करिए. आप रोज रेड मीट खाओगे जिसमें लॉट ऑफ unsaturated fatty acids are there, it's obviously हानिकारक. So generally I tell my people that if you're a vegetarian, green leafy vegetables, lot of fruits. If you're a non-vegetarian,
Hmm.
3 4 times a week you can have your veggies. That means a vegetarian meal. You have white meats. Fish is very very good. It is again chemo preventive. The omega fatty acids are very very good. And cut down your red meats,
Hmm.
cut down your processed meats. So there are a lot of things because those processed meats have nitrosamines. They're cured with various things. वो थोड़ी सी कम कर लो जो
Hmm.
आपके पिज्जा पे डालते हैं. If you go abroad, pepperoni, and these are all cured meats.
Correct, correct.
So, and then when you cook your meat, please cook it decently. If you put half a kilo of oil and there's a big thick layer floating on top, it comes out of the meat and then you eat it, you'll say it's tasty, but that's not the good way of eating it. Grill it
Right.
so that you don't put extra oil. The oil of the meat drops down, so that's pretty good. That if you have to eat meat, you can do it that way. So there are certain things, and there's certain products like you don't want to have colas daily because colas have they all additives. They make you put on weight. The weight, it may not be directly
Hmm.
causing a cancer immediately, but the side effects are more. And these good habits
Right.
are extrapolated to other NCDs. NCD means non communicable diseases. So, your heart,
Hmm.
your lung, your cancer, your diabetes, all are linked to these bad eating habits. So if you eat
Correct.
well,
Absolutely.
you will prevent your heart problems. आप कैंसर की क्या सोच रहे हो? Okay, if you don't get a cancer, you might get a heart attack at 50 and it might affect your quality of life. So please eat healthy. You
Right.
know, they say, and I've got a lovely slide. I'm not allowed to show it. I've got a lovely slide of a plate drawn, a plate. And in the plate, it's
Hmm.
divided into 4 quarters with different colors. One quarter says, this is all you need to live and be healthy. The other three are shaded one color and it says, this is for your doctor. So basically, if you eat a full plate, आप अपनी डॉक्टर की प्रैक्टिस बढ़ा रहे हो. आप थोड़ी मॉडरेशन में खाइए, हेल्दी खाइए,
Hi.
सब ठीक होगी. कैंसर क्या, आपकी फुल लाइफ विल बी
Correct.
वेरी वेरी हेल्दी.
Nothing will touch you. The next thing is Mr. Ratnam's asking us. I think we have time for just a couple of questions now. What are the tests that one should take annually to detect cancers?
So there's no one test that we do annually to detect cancer, but generally as you go older, we screen men for the three common cancers that are common in men. That is head and neck cancers, which is a simple examination, lung cancer, which we can see with the chest, particularly if they're smokers, and prostate cancer. For women, we will screen them for breast and cervical cancer. If they're tobacco users, it will be the head
Annually.
and neck cancers and the lung cancers. Please remember the tests to screen for
Hmm.
cancers are very simple, freely available, and not costly. So for head and neck cancer, you
Hmm.
just need a good examination by an ENT. If you want to look at the abdomen, we can do a simple ultrasound. The commonest part of any intestinal cancer is blood dropping in your stool. You can just do your stool routine examination for occult blood. It's a very simple. 100 रुपए के कम में
Right.
होगी. PSA is
Correct.
freely available. For ladies, you do the pap
Hmm.
smear again, freely available, a couple of 100 rupees, and you have screened for pap smear. But we don't recommend all these tests at one go. So if a lady, like I said, after 35, every other year will have the pap smear, if it's okay in 3 consecutive times, generally you don't have to continue it for life. Mammogram
Hmm.
should be done among people who have a family history. A lady feels that she is not change in the consistency of breast. So, ladies, another clue I want to give you all: breast cancer is now being seen even in younger people. Earlier, it was in much earlier. In do breast self examination. Do breast self
Right.
examination in the latter part of your menstrual cycle. and examine the breast with the flat of your hand. Do it in the quiet of your bedroom. Do it when you're having a bath. You feel any abnormal lump with the flat of your hand, second half of menstrual cycle, please go see your specialist. The simple mammogram will help us to get that diagnosis much earlier. So, really, there's no one
Right.
test that we would recommend, but I recommend you doing all your blood tests and certain cancer specific tests, like I said, PSA or a pap smear in a lady or a mammogram when
Hmm.
indicated after you're 50
Right.
years of age. Please do all your blood tests regularly.
So, last question I'm going to take right now, doctor, and I think a couple of people have asked this. Is there any research on high protein diet and COVID vaccine triggering cancers or lymphoma?
No, I'm not aware of this. So, is it that if you take a high protein diet and you take the COVID vaccine, you get cancer? Is that the
No,
question?
either or. If you take a high no, if you take a high protein diet, will that lead to cancer, or does COVID vaccination could lead to cancer as well? Is there any research on any of these?
No. Not to my knowledge. There may be some isolated reports coming here and there. COVID is a recent occurrence. 2 साल भी नहीं हुए COVID हुए. So it's very, very unlikely that the vaccine is going to cause a cancer. Please don't worry. Generally, any vaccination that we give, any vaccination, it usually undergoes tests. Those vaccines also are attenuated forms of the virus or an attenuated form from the RNA or the DNA of that organism that we are using it. It might come from any source. It stimulates your immune system. It's very, very unlikely that a vaccine will cause problem. Yes, vaccines do. Everything that you insert into your body may have some minor side effects, but generally
Right.
they're absolutely manageable. They've gone through regulatory authorities, so I don't think that you need to worry. My message is, if you've asked me this question and you're not vaccinated for COVID, please go get vaccinated. The risks of
Go ahead
contracting
and get it
COVID
done.
are more lethal than this so-called theoretical scare कि मुझे कैंसर हो जाएगी, ये होगी, कुछ कुछ नहीं होगा.
Right. Okay, doctor, it's time now for you to give us your top tips. So please go on.
So, my top tips for you all today. Firstly, thank you for having me on the show. My top tips is the incidence of cancer is increasing. You will have someone in your family, your friend, your neighborhood, your colleague who will have cancer. But cancer is preventable. Two-thirds of cancers can be avoided by a healthy lifestyle, avoiding habits of tobacco, alcohol, keeping your weight in check, and avoiding infections, keeping your body absolutely clean and hygienic. Cancer, if you get and it is diagnosed early, is absolutely curable with minimal side effects and very, very mild treatment, upwards of 90%. So, early detection is important. You must know the warning signs. Any warning sign like a new growth, a change in the size of an existing growth, bleeding from any orifice of your body, change in bowel bladder habits, go to your doctor. If it persists for more than 4 weeks, and have a screening test done, which will diagnose it at an early stage and give you a near 100% chance of cure. Lead a healthy lifestyle, eat a chemo preventive diet, and that is very, very important to get the best outcomes. And God forbid you come in the unlucky group that gets a cancer, don't panic. Please put your mind to the problem. Please research just as you would do for other major decisions, like when you buy your house, your TV, your car. Choose a right place, an institution that has a good infrastructure, most importantly, a doctor who specializes in the problem that you have, and you will have excellent outcomes. Like I said, if you're cured of cancer, you don't need to worry, unlike diabetes and hypertension, where you need to continue your drugs for the entire lifetime of that person. So, prevention, early detection, and treating adequately are my top tips to you all this morning. Thank you.
Thank you so very much, Doctor, for joining us today and giving us such incredible insights. It's been a pleasure and an honor
Namaskar.
talking to you. Thank you so much again for joining
Welcome.
us.
Pleasure. Thank you for having me on the show.
And guys, now it's time for the quiz. I hope you all are ready. I'm going to give you a tip. Some of the questions will be easier to answer if you have the Apollo 27 app on your phone. Very simple things to do. Just answer the questions over the chat. Winners' names will be announced at the end of the show. Winner to mail their contact details at marketing@apollo247.com, and gift vouchers will be shared with you. Okay, so here's the questions. The first one: when is the World Cancer Day celebrated? Once again, when is the World Cancer Day celebrated? 2. What is the cancer of blood cells called? 2. What is the cancer of blood cells called? And 3. Which option on the Apollo 24/7 app enables you to scan and upload your past health records? Question number 3 is: which option on the Apollo 24/7 app enables you to scan and upload your past health records? So go along and answer these questions. This festive season, Apollo 24/7 gives you a chance to make your Diwali extra special. Now, you can get a 25% off on your first 3 online medicine orders. So don't stop at once. Save thrice with a coupon code of FIRST3 or first 3. Order now on the Apollo 24/7 app and the website. Well, before I announce the winners, I have a very special message for all of our viewers. We are well into our festive season, and this year, finally, there is happiness and positivity all around us. But let's not forget that it's only because of the hard work and sacrifices of our frontline workers that we are where we are today. We've put together a little something to show our gratitude to our heroes, and we hope that they too can celebrate festivals with their loved ones this time. Please find the link to watch it in the description box. For every share on the video, Apollo 24/7 will contribute rupees 100 to Saving a Child's Health Foundation. So let's come together and do our little bit for this good cause. Could we have the audio visual, please?
Surprise! इस बार मैं भी
मम्मा मम्मा पापा
इस बार मैं भी
ईद मुबारक भाई। इस बार मैं भी।
इस बार मैं भी
इस बार मैं भी
इस बार हर कोई मनाएगा त्योहारों की खुशियां अपनों के साथ। पिछले 2 साल से हमारे फ्रंटलाइन वर्कर्स की बदौलत ये मुमकिन हो पाया है कि हम सब अपनों के साथ हर त्योहार की खुशी बांट सके। इस बार हम आशा करते हैं कि वो भी त्योहारों की हर खुशी अपनों के साथ मना सके।
What a lovely, heartwarming film that brought a smile to my face. And in case you have any questions about any health concerns, you can use the special coupon code HH247 to get rupees 199 off on your online consultation and 15% off on medicine orders placed on the Apollo 247 app. Now for the big moment, the winners of the quiz. Winner number 1 is Chesta Mishra. Number 2 is Venkat Himadri and Sheshadri K. Thank you so much. Congratulations to all of our winners here. And thanks for each one of you to join us and participate. And I hope that you found this information shared useful and would follow the amazing tips shared by our doctor. We'd like to say goodbye here, and we'll be back again with another important topic and an Apollo expert next Sunday at 11 a.m. So stay tuned and keep wearing that mask to stay safe. Goodbye and God bless.